Ladies and gentlemen, distinguished guests, universal health coverage is now embedded in the 2030 Agenda for Sustainable Development, where it serves as the platform for reaching all other health-related goals. In September 2016, I announced the establishment of the International Health Partnership for UHC 2030. The aim in transforming the IHP Plus mandate is to provide a platform for accelerated, coordinated, and sustainable progress towards UHC, in which all partners share the vision of equitable, quality healthcare that does not cause financial hardship.
My name is Dosumu Samuel Ekukun. I represent the good people of Lagos State, and I bring the courtesies of His Excellency, the Governor of Lagos State, Mr. Akin Mambodi, through the Honorable Commissioner for Local Government and Community Affairs, the Muslim Folami.
My name is Oladisi Akinbodi. I work with the News Agency of Nigeria.
I'm Olamide Folaunmi. I represent Virtues Unlimited Restorative Justice Initiative.
My name is Laja Abiriora. I work for the National Health Insurance Scheme in Nigeria.
Hi, I hope you're having a really successful meeting in Nigeria. It's a great pleasure to be able to just talk to you briefly about UHC 2030 and especially what we're trying to build around civil society involvement in that new movement. My name's Simon Wright. I work for Save the Children in London, and one of the roles that I've got is that I'm on the steering committee of UHC 2030 to represent northern civil society organisations.
My name is Lucy Chesera. I work for an organisation called Tuberculosis Advocacy Consortium.
I'm Dr. Kayode Oguni from the State Primary Care Development Board, State of Osun.
My name is Amy Oyekule. I am the Vice President for the Wellbeing Foundation Africa.
My name is Bella. I'm the founder and Chief Executive Officer of Bella Foundation for Child and Maternal Care based in Edo State, Nigeria.
My name is Rekia Zubeiru. I'm representing ISMPH, which is the International Society for Media in Public Health.
My name is Madam Bella Michael. I'm representing a community-based organization.
For the past 2 days, it's been very educative and impactful, and a lot of issues have been raised, a lot of collaborations have been fostered, and we are looking forward to partnering with civil society organizations, especially the ones that are affiliated to Lagos State, to foster better relationship, to know the workings and how to bring primary health care deliverables to the citizens of Lagos State.
I've been pretty impressed with the energy that's come out of this meeting, and it speaks to the fact that people are now ready to move the Nigerian African health agenda forward for the greater good.
I must confess that the two days experience at the conference has been very overwhelming. The discussions have been very detailed and deep in content. All areas of CSO's challenges and benefits and their responsibilities towards making adequate provision in the area of primary health care to the citizen is discussed extensively. I give kudos to them in this regard.
I think the IHP needs to support a process of bringing together at a larger level stakeholders in this journey towards UHC at the level of public, private, and civil society.
My take home for this conversation, the meeting that just ended today, is that UHC 2030 is not 100% donor driven, but that we should begin to look at contribution from the government, taxes, and from contribution from private sector.
Especially the kind of results oriented and need-based budgeting as regards universal health coverage. The question has always been on that universal health coverage is supposed to be health for all at no cost to no one. But now we know better that somebody must be targeted to pay for it. And of course, this time around it's going to be all-inclusive.
In all this discussion, in defining the strategic way forward, we should also understand the constraints of government.
Then an offshoot of that was what we call the Community Health Sector Forum, which is mainly for CSOs. We have, we have evolved what I would call a very good system for donor coordination, so to speak.
Society in Nigeria and in Africa in general is organizing. We are organizing because we know what we want. We have seen what is on ground, and we are determined to have an effective and efficient primary healthcare system that builds upon structures that are functional, that builds upon providing good governance for our citizens, and build upon strengthening civil society and government and the donor community to work efficiently and effectively for better health for all.
My message from this part of this world is simple, that they need to look at the peculiarities as it affects the people rather than we have imported policy or events. It has to fit into the system we find ourselves.
This meeting was not in vain. Let's do it again to ensure that the wider voice of civil society is propelled to the highest level, considering that we are looking at our local priorities, being what will drive the agenda for us to be able to get to universal health coverage by 2030.
I want to really appreciate this kind of a conference, that this issue keep coming up as well as to educate our people and to let our people know what the government is doing and what we can do to better the effort of the government.
First, let me extend appreciation to everyone who has participated in this meeting. And the energy brought to the meeting, the commitment of civil society and governments and other stakeholders to work together to achieve UHC and the health goals of the SDG by 2030 in our countries is palpable and visible. I must also thank those who have graciously provided resources for this meeting. Ariana Childs Graham from PI and her colleagues, and my colleagues and my other colleagues in the Global PHC Strategy Group have helped to shape the directions of this meeting, as well as Bruno, Riverland, and Anik and Marjolene from the Civil Society Engagement Platform and the IHP for 2030 mechanism in WHO have been very, very critical to ensuring this happens.
Thank you so very much for the opportunity.
Thank you.
So thank you.
Thank you very much.